So Dr. Teo, how do we define obesity actually? And sometimes we hear the term about morbid obesity. What is the difference?
All right. In general, if a person has a BMI or body mass index of more than 30 kilogram per meter square, is classified as having obesity. And the term morbid obesity or severe obesity actually signifies a person's BMI of more than 40. So back to the diagnosis of obesity. For Asian, the threshold for diagnosing obesity is lowered to 27.5 because at this level of BMI, actually Asian has a much more risk of developing complication or comorbidities like diabetes, high blood pressure, heart disease, etc. And then, though all these diagnoses, classification uses a number BMI, in actuality, World Health Organization defines obesity as someone having excess fat accumulation in their body, which impacts their health. So it's not all about numbers that define someone's health.
Yeah, exactly. BMI doesn't tell us the whole picture. So sometimes by just checking BMI, it just tells us how it's the ratios of your weight to your height. Dr. Teo, could you share us what are the benefits?
Yeah, I totally agree with both of you, Dr. Kelvin and Verona. So other than the benefits that you guys mentioned, improve in the immune system, reduce risk of severe COVID, there are a lots of other benefits from treating obesity and get a good amount of weight loss. So for example, for instance, patients with diabetes, high blood pressure, high cholesterol level, they will benefit from weight loss through the treatment of obesity. So for instance, 5% of weight loss in these patients, they can get a better control of their parameters, blood profiles, blood pressure profiles, etc. And if they are able to lose more than 10% of weight, then other disease like acid reflux, sleep apnea will get better symptom control and even get remission of diabetes. So this is very wonderful that treating obesity, then it settles the other diseases, and what I call as treating the roots and not the fruits of obesity. So usually we treat diabetes, focus on that, and why not we treat obesity and then we manage the diabetes at the same time.
Yeah, one stone kill many birds, right? We're just treating obesity. So that is very amazing. And sometimes we also hear people say that, yeah, to lose weight, it sounds like very simple, but it's not that simple because by itself, obesity is a chronic disease. Not only chronic disease, it's a chronic multifactorial disease, right? And also, it will also affect us, and sometimes this obesity problem, they say, I try very hard, but there's still other forces that pulling me at the back that I can't achieve my weight. So Dr. Teo, how you look into this?
You're absolutely right. The way you say, you see, our community always stigmatize and blame the patient living with obesity. So the words like lazy, sloppy, lack of willpower are the common phrases used to describe the patient living with obesity. And then a lot of us believe that shaming and blaming them will encourage them to lose weight. Is that so? It's not, because evidence has shown that it doesn't help in that aspect. So because we understand obesity as a multifactorial complex disease, as Verona said. So, for example, genetic predispositions, patient underlying medical condition, and the medication that used to treat these diseases, for example, diabetes using insulin, chronic pain, neuropathic pain using pregabalin, and this type of special medication which encourages weight gain. And at the same time, patient may have a history of childhood trauma, childhood upbringing, difference of childhood upbringing. Obesogenic environments, workplace, policies, all these interactions of the factors cause the propagation of the disease of obesity in the world.
Yeah, because sometimes we also will hear from our patients saying they even break down in our room saying that they try very hard, they work very hard, but at the end they didn't get anything, and people are still stigmatize them saying that you are lazy, you are not working hard enough, right? So this is kind of a sad story. So that is why we want to have a conversations about that to tell everyone, hey, don't worry, we are here for you. Eating less, moving more is no longer applicable to all the patients with obesity. So if you are having obesity problem, you are facing these issues, this is not the only solution for you. And we have many other strategies and different types of approach. Dr. Teo, could you share us a bit more about the treatment of obesity?
Yeah, it's my pleasure to share because it's my field as an obesity medicine physician and family medicine specialist. My aim is actually, and we as a team, is to help patients to improve their health and quality of life through medical or surgical weight management for Dr. Kelvin's case. So there are three main strategies and options in treating obesity. The first one will be lifestyle interventions. It can be healthful eating, good physical activity, and then behavioral modifications. These strategies, it can be through self-directed and self-learning, or sometimes you can go to a professional supervision like dietitian, exercise physiologist, physiotherapists with special interests, psychologists, etc., etc. And the other two options are like anti-obesity medication. We have a handful of choice to select in Malaysia. Those reduce fat absorptions, which act peripherally, and then an anorectic agent like to reduce your appetite. Medication, it can be injectable or oral medications. And the third options will be the bariatric metabolic surgery. And it's becoming common to see these options in combinations rather than in silo as in the past.
So we can combine different approaches. Yeah, so holistic approach is far more important and far more beneficial to our patients itself.